Hi everyone, Dr. Emmy from Pain Free and Fit. Today we're going to be going over how to train biceps with lower back spondylolisthesis to avoid pain and injury. Hope you enjoy. So one of the most common problems I see with people with lower back spondylolisthesis aggravating their back pain while biceps training is increasing the arch in the lower back. Remember, the natural arch or lordosis in your lower back, when it's increased by either raising the tail up or having the pelvis rock forward into an anterior tilt or leaning the upper body backwards, it compresses the back of the spine. It causes a forward motion of the vertebra. And when the vertebrae are already slipped forward with spondylolisthesis, that increased arching typically is going to irritate them because it helps that vertebra to slide just a little bit more and it irritates soft tissues. So this typically happens with standing curls, whether we're using barbells or dumbbells. As we get further down into the set and the biceps start to fatigue, typically what happens is the person will start leaning their upper body backwards and throwing their hips forward. Now I'm exaggerating that, but sometimes it's as little as just a tiny motion like that to help get the bar up and complete the rep that's going to irritate the back. So you could use your abdominal muscles to prevent this by tucking the tailbone under and crunching the ribs down so as to highlight the abs. That'll help to prevent that curve from increasing. But another way of doing it is using a split stance. By putting one leg back as a post, it helps to artificially give you stabilization in a front to back motion. When the legs are together, the body's a lot easier to sway. When the legs are in a split stance, it's much more difficult because we have an artificial post back there. So using that post with that abdominal tension is a great way to help avoid irritating the back. Another option is in this position, especially if you have acute pain where the pain is really bad and the tiniest motions irritate, is as opposed to switching or using a barbell for that exercise, using a dumbbell one at a time is a lot less likely to cause that extension. Dumbbell work while curling typically has a more lateral flexion component on it. So this is typically not going to be an irritant to most people with spondylo, although it may aggravate some. And if so, just try to keep that front hip down and the rib up as you're curling. So I would do my curls on one side and then the other if that was the situation, or if I don't have a problem with lateral flexion, I can use a split stance and just use alternating curls. Using a wall or a post to curl in also is a great idea. If I set my feet forward 6 inches from the wall and lean back into it while I curl, now because my legs are forward and even I could bend my knees to help with this, it's a lot easier to hold my tailbone under that posterior pelvic tilt. And either with barbell or dumbbells, as I curl now, my back will be flatter and the wall is preventing me from using that motion of throwing myself back. You still have to be careful with the hips though, because if you lose the tail under and your hips come too far forward to bring the bar up, you could arch the back. So try to keep the hips in position with that one. Another topic to talk about is seated versus standing with spondylolisthesis and curling. When we sit, we naturally have a slight tail under a posterior pelvic tilt. So a seated position, for instance, is many times a lot easier on curls to prevent that arch versus standing. Preacher curls, where we're moving our upper arms over a bench and doing Scott curls or preacher curls, also has a tendency to decrease that curve because as we lean forward, the arch in the back has a tendency to decrease. So many times preacher curls will be easier options for those with spondylo who are aggravated with too much extension. Now, if your spondylolisthesis is aggravated because the disc at that level of spondylo is herniated and you have too much flexion and it's pushing that nuclear material in the disc backwards into the herniation and that's what's causing your pain, just the opposite. You'd be better off standing, going back to that split stance or wall curl, because sitting is going to increase the compression on that disc, and especially if you're doing a preacher curl, there's going to be more flexion with that. That's typically going to aggravate the lower back pain. Now another option for you with spondylolisthesis is using a pull-up or a chin mechanism for your curls. Many people, when they do chins, they think it's just mainly back muscle and not bicep. But if you limit the range of motion so that you're trying to keep your elbows forward but not back as you do your chin, you'll notice you'll get a lot more biceps action out of it. and less latissimus or lat action. And that's a technique that you have to work on. Sometimes you have to work on a wall or a small chin bar next to a wall to block the elbows, but as you get better at it, you could even do it on a lat pull-down machine to begin with. Just try keeping your elbows forward to complete that chin-like motion. By doing this, you'll feel a lot more in your biceps. If you're using a regular chinning bar and want to get lat and biceps together, the plus of this is that typically as we chin, most people have a tendency to swing their hips slightly forward. So they make it a little bit of a row motion. Remember, a row motion is more front to back versus a true pull down or chin, which is a vertical up and down motion. Because the lats are stronger at this range of motion, you can always row a lot more than you can pull. Typically what happens is, especially later in the set, as we get fatigued, the hips will roll forward, and most people will contract their abs with that. And as the hips roll forward to do or complete a chin, you're taking that arch in the back and you're decreasing it. You're letting the tailbone come under, the lower back arch is decreasing, and you're still getting a great biceps workout. Chins, by the way, and pull downs, many times the top people that are training in bodybuilding will tell you that a reverse grip pull down or a chin is going to be a much greater biceps workout to stimulate growth than any type of isolation exercise. So plug these tips into your next biceps workout and hopefully it'll help to reduce your spondylolisthesis pain. Remember always, if you're looking for a great way to analyze your body mechanics, figure out how to create a stabilization exercise program for spondylolisthesis without hurting yourself, check out our Fast Track program available at painfreeandfit.com. And as always, I'm available online through Zoom for your consultations when it comes to exercise and preventing your spondylolisthesis pain. I hope this video on biceps training and spondylolisthesis helps you with your chronic lower back pain.